Why is this youngster on the nurse's lap? Because he has whooping cough, a common infection the medical gang call pertussis. So what's so bad about pertussis? It's a highly contagious bacterial infection that can last for weeks or months and be devastating, especially in infants, and even cause death. Why particularly in infants? Because it is a germ that attaches to the lining of the respiratory tract and severely compromises passage of air in and out of the baby's lungs. These passages, of course, are smallest in infants, and a mild degree of obstruction can prevent the necessary oxygen from reaching the lungs from where it is distributed to the rest of the body. Why the nickname whooping cough? Because in his efforts to get air to the lungs, the infant coughs repeatedly and struggles over and over again, and, when eventually successful, has a large inflow of air accompanied by the characteristic whooping sound. How does one prevent pertussis? Since the mid-1940s, there have been vaccines successful in preventing pertussis, resulting in a striking reduction in the number of cases and deaths from whooping cough. These vaccines have been improved and made less toxic over the years. Why do we still hear about cases of whooping cough? Several reasons. Infants can't receive the vaccine until 2 months of age and need several doses at 2, 4, and 6 months to become immune, so they remain susceptible until halfway through their first year of life. Recently, it has been recommended that pregnant women receive a dose of pertussis vaccine in the later months of pregnancy so that the antibodies they develop will be passed through the placenta to their infants and hopefully protect them during those initial months of life. The other reason is that some people choose not to receive the vaccine and therefore remain susceptible. Why do we get further injections of the vaccine when we're no longer infants? In order to maintain protection against the whooping cough organism, booster injections are necessary at various intervals: 12 to 18 months of age, 4 to 6 years of age, and 11 to 18 years of age. The vaccine infants and young children receive is a combination with diphtheria and tetanus vaccines. Big D, Big T, small a, big P, or DTaP. Beyond age 10 years, the vaccine is altered somewhat, reducing the diphtheria component, and is labeled Big T, small d, small a, big P, or Tdap. It is also recommended that adults receive a dose of Tdap, and especially so if they will be in contact with an infant in the first months of life. This is particularly true of grandparents. How effective is the vaccine in preventing pertussis infection? Although it is highly effective, especially in those early years of life, protection diminishes with age, and one may get modified disease when exposed. Not usually whooping cough, but a prolonged, milder coughing infection. These folks with modified disease may be the likely ones to pass the infection on to unimmunized children, including at-risk infants. Are there any complications of whooping cough? Yes. Pneumonia is the most common, but also seizures and rarely what we call encephalopathy or effects on the brain. Are there effective treatments? Although early on, before coughing begins, some antibiotics, like erythromycin, may modify the illness, but they provide little help once the whooping has begun. This further emphasizes the need to protect by immunization, not rely on unsuccessful treatment.